here in Oakland County and in the state of Michigan, we're seeing an uptick in cases of Legionnaires disease. And I think because of COVID-19 and obviously all the talk with the Delta variant, it maybe isn't getting the attention that it deserves. So with that, we want to bring in Dr. Russell Faust back with us again here on the MegaCast. Of course, he's the medical director over at Oakland County Health Division. And Dr. Faust, thank you again for being with us. But for those that aren't familiar with Legionnaires disease, what exactly is it?
Great question, and good to see you again, Ronnie, and thanks for the invitation to join you. So Legionnaires disease is an infection caused by a bacterium that can cause two different clinical entities. The first is Legionnaires disease, which is a pneumonia, and it can also be infection in other areas of the body. And the other is actually named for Pontiac, Michigan, so Pontiac disease. And that is all of the symptoms. It can have GI symptoms and fatigue and headache and aches and pains, but without the pneumonia. And that is the Pontiac disease is really self-limited. Doesn't require treatment with antibiotics. It's not a severe infection, and the body's immune system generally takes care of that. Legionnaires, on the other hand, can be quite severe and a serious infection. You know, that pneumonia can be fatal, in fact. So requires antibiotics, and the vast majority of those people end up being hospitalized.
Dr. Faust, I'm so glad that we have you on. And I will say, this is the first time I've heard of Pontiac disease, and we live here, and it came out of this area. How does one contract Pontiac disease or Legionnaires? Where does it come from?
That's a great question. You know, it is one of the many microbes that live in water. And so, you know, we first became familiar with it at a Legionnaires convention, and I believe it was a hotel in Philadelphia. And a number of these Legionnaires became infected with a pneumonia, and the CDC began to do the investigation, and it became clear that it was the result of bacteria in the cooling tower for that hotel. Wow. There were hundreds and hundreds of Legionnaires meeting at this convention, and a large number of them became infected with pneumonia, and a fair number died from this. So that brought it to the world's attention. Subsequently, we see a level of Legionnaires disease on an annual basis, and it peaks somewhere usually around August, September. And this year, because, well, we can speculate why this would be, but the peak seems to be moving a little bit earlier. That is, you know, here we are, June, July, and we're starting to see these cases peak. So, excuse me. And there are a number of factors involved. I'd be happy to kind of speculate, but you know, for a year and a half, people have been essentially working from home. They haven't been going into work. They haven't been in places that have these complex water systems. Your residential water system in your house is used often enough. It's flushed, and although Legionella might be in that system, it's flushed, and it is not a risk of exposure. The complex water systems that we have in these large buildings, especially if they sit stagnant for a long time, risk Legionella building up in the system. And certainly these systems have been stagnant, unused for an extended period now through the pandemic. People are going back to work now. There's a greater exposure risk potentially. And in addition, CDC tells us that wet and warm conditions increase the risk of exposure. So, you know, here we are. We've had a couple of floods, And if I go back and look historically at the weather, which I just happened to do late yesterday, if we don't have the full July to look at, but if we go back a month and compare June of 2021 to, let's say, June of 2019, we're looking at more than double the amount of rainfall in June. And we're looking at an average, when we look at the average temperature across the month of June, the average temperature of this year versus 2019 is up 6 degrees Fahrenheit. So we're talking warmer, wetter weather, and people, are exposed because of that. The folks that are at risk, we really should talk about these. And I hate to call this elderly because I'm in this category, but anybody above the age of 50 is at greater risk. Anybody who has previously or currently smokes tobacco is at greater risk. Anybody who's immunocompromised is at greater risk, or has chronic pulmonary disease, emphysema, etc. So, the CDC, the MDHHS issued a press release saying that, we had this enormous increase in cases this July versus last year. Well, of course we do. People were home last year at this time. So if we look from, say, July to July, not the calendar year, but July to July, we go back 1 year from now. Of course, there were virtually no cases last year. If we go back the year prior to that, we have a bump in cases from then to now. It's warmer, it's wetter, so we have a bump in cases. But if we go back another year, at 2018, we're actually down by about 24% in case numbers. So it fluctuates year to year. I will say this, for the last 20 years, there's been just a gradual increase in case numbers, nationally, statewide, and countywide.
So if I can ask you, Doctor, because for so many of us, we didn't really hear of Legionnaires' disease until the Flint water crisis. So now when we hear it, there's a panic that comes with hearing Legionnaires' disease. So is there a way to avoid getting it?
Yeah, that's a great question. So if people have things like hot tubs or more complex water systems in their homes, they basically need to keep the pH correct and disinfection correct per manufacturer's instructions. But again, in residential homes, it's not really a risk. The risks tend to be, and I didn't include this in the kind of the list of folks, the demographic that are at risk, but folks that also are traveling. As we go back through our case numbers, that's one of the questions that our epidemiologists ask people, is whether they've been traveling, whether they've been staying in hotels, whether they've been using hot tubs in hotels or gyms, things like that. So those are potential exposures. But in general, in our own homes, that's not a risk. The risk is, we know that Legionella, as with a number of other bacteria, are in water and in water supplies. So anytime we're around water that's been aerosolized, misted, then that's a potential exposure.
So this isn't coming from, is it coming from drinking water as well? So is it better if to take bottled water from our home?
It can come from drinking water, yes. When we have cases identified to us, when we're called with cases, our epidemiologist will do a very, very detailed interview, examination. And, if you think about where you've been in the last 2 weeks, boy, it's a long list of places potentially.
Right, it's hard to remember where I was yesterday, right?
Yeah, exactly. And so, we find out where they've been, and then we'll go out and inspect those places potentially and find out whether there is a common exposure. Certainly if we have more than one case and they have a location in common, then we absolutely have our environmental health experts go out and conduct an examination and inspection. of those sites.
So have we found how many cases in Oakland County recently, and have you found that one common denominator in any of these cases?
We haven't.
Wow.
We actually, as of 4:30 this morning, we are up to 18 cases for this month. We have 30 cases total for the year, for the calendar year,
Wow.
which, again, looking back, is not that unusual. But of course, given the state's experience with Flint, they're going to be notifying people in a press release. What is a little bit interesting is that our cases range from age 26 up into the 90s. And in looking back, I've gone through our cases for the last 3 or 4 years. Looking back, generally they do fall above the age of 50. And so we've had a couple cases. 2 years ago, we had some that were in the 20s. And again, virtually all of these, all but 2 were hospitalized in the 30 that I'm talking about this year. All but 2 were hospitalized. So it's something that if someone believes that they've been, say in the backyard messing with the fountain, and then within the next week or 2, they have headaches, they're coughing, and weak, and feel like they're ill, they need to contact their physician or go to urgent care or the ER, and say, I may have been exposed to aerosolized misted water, and I've got this. They'll be examined and checked out for Legionnaires. There's 2 things that they'll look for pneumonia, and they conduct a test on urine. It's almost like a pregnancy test. The little card. It's a urine dipstick basically for the antigen from the bacteria.
So it's a quick test then.
A very easy, quick test.
Dr. Russell Faust with us here on the MegaCast. He's a medical director over at Oakland County Health Division. And Dr. Faust, can I ask, at what point in time should someone understand that they need to seek medical help?
Oh, always. If somebody has shortness of breath, anytime anybody, for whatever they think the reason might be, if they're short of breath, they have difficulty with exertion, climbing the usual flight of stairs that is normally not a problem for them, then they need to seek attention.
Just another minute or 2 here with you,
Yep.
Dr. Faust, and I know that we brought you on to talk about Legionnaires, but I want to ask you if we could kind of jump back to COVID-19, because with the Delta variant spreading so rapidly, a friend asked me this the other day. I was like, I don't know. If someone is vaccinated, should they still go ahead and wear a mask due to the concerns of the Delta variant, or if they do, at least if they're going to be in like a large crowd?
So here's the issue with masks. Wearing a mask really protects those around you from you potentially being infected with COVID-19. It prevents those respiratory droplets that I'm generating right now talking. It prevents those respiratory droplets from getting out and exposing those around you. The mask isn't as protective as we would like to protect us from being exposed to others, unless you're wearing an N95 mask,
Right.
that is, sealed and fitted and is very good at filtering out particulate. The issue right now is that we know that we're at about 70% vaccinated in Oakland County. But when I go out, and that people who are unvaccinated should be wearing masks. But when I go out into the store, virtually 100% are unmasked.
Yeah.
So we know that there are folks around us all the time that are unvaccinated, that are not wearing masks. Really, the issue is those people are at risk for being infected with COVID-19, but specifically Delta variant. We know that they're highly vulnerable, and we know that it's very easily transmitted, which means even those of us who are fully vaccinated are at greater risk because it's so easily transmitted. And so I just ask folks that if they're not vaccinated, they should be wearing a mask. And more than that, I've said it a million times, every active infection is a factory that's generating mutations.
Yeah.
It's producing variants. So we just need to be vaccinated. We need 100% vaccinated. 70% was a great goal. It's great to be there. But everybody needs to be vaccinated because this is just going to continue on as infected people produce variants.
And the longer it continues, the longer we remain in the pandemic. Dr. Faust, it's been so great having you and your expertise and your guidance throughout this pandemic, but also to alert us to other things going on. We want to say thank you for your time, and I hope you enjoy your weekend.
Thank you so much. Thanks for the invitation to be here.